Are there specific genetic mutations driving bone fibrosarcoma? Let's dive into the question of whether specific genetic mutations drive bone fibrosarcoma. Yes, researchers have identified certain genetic mutations that play a role in this type of cancer, although the research is still ongoing. One of the most commonly reported genetic changes in fibrosarcoma involves the loss of the CDKN2A and CDKN2B genes. These genes are crucial for regulating the cell cycle and suppressing tumors. When they are altered, it can lead to malignant transformation and tumor growth. Another important gene is TP53. Mutations in this gene are frequently observed in fibrosarcoma as well. TP53 is known as a tumor suppressor gene, and its alteration can significantly contribute to cancer development. Additionally, researchers have noted mutations in other genes such as NF1, Notch, BAP1, SMAD4, TERT, FANCA, FANCT2, and PTCH1. However, some of these mutations are considered variants of uncertain significance, meaning their impact is not fully understood yet. In the case of infantile fibrosarcoma, which is more common in children, there is a notable genetic alteration involving the NTRK gene family. About 90% of infantile fibrosarcomas show abnormalities in these genes, which are essential for cell signaling. These mutations can lead to uncontrolled cell growth and the formation of tumors. Bone fibrosarcoma is part of a diverse group of sarcomas that have complex genetic characteristics. While mutations like TP53 and CDKN2A are frequently found, the overall tumor mutational burden tends to be low. However, there is a high fraction of genome alterations, indicating chromosomal instability. Advancements in next-generation sequencing technologies have enhanced our ability to detect these mutations, which can aid in diagnosis and treatment planning. In summary, bone fibrosarcoma is driven by specific genetic mutations, primarily involving tumor suppressor genes like CDKN2A and TP53. Additionally, alterations in other genes depend on the tumor subtype and the individual patient. For infantile fibrosarcoma, NTRK gene fusions are particularly significant. These findings are crucial for diagnosis, prognosis, and the development of targeted therapies. However, treatment decisions should always be personalized and guided by healthcare professionals.